From Denver 7, this is 7 News.
Covering the Capitol, lawmakers proclaimed today Congenital Heart Defect Day in an effort to bring awareness to testing that can be done immediately after a baby is born. 7 News reporter Dale Cedars looking into this, and you found a proposed national law could give some misleading results for Colorado babies.
Teresa, the Academy of Pediatrics wants to make a law that every baby has a pulse ox test at birth. Now, any child with a number below 95 would then have to go through additional screening. But here in Colorado, a lot of healthy babies are born with oxygen saturation numbers below 95 because we are at a mile high.
They had to give him CPR twice to bring him back.
But 7-week-old Aiden Brazil is not only back, he's better than ever. And he even has the war wounds to prove it.
This is the scar from his open heart surgery.
Aiden was born with TGA,
which is where his pulmonary artery and his aorta were switched around.
At 5 hours old, this little man was flown to Presbyterian St. Luke's for open heart surgery.
I wish I would have known when I was pregnant.
So do the doctors, so she could have been here when she delivered.
And in this hospital, that delivery room is steps away from the intensive care nursery, so they don't even have to go on a helicopter or an ambulance to get this state-of-the-art care.
That's the reason what's called a pulse ox test is so important. It measures the percent of oxygen in the bloodstream when a baby's first born.
Pulse oximetry will tell a physician or whoever's measuring it that there may be the potential for some serious heart disease if the saturation is below a certain number.
The National Academy of Pediatrics says that number is 95. But doctors at PSL say that could give incorrect readings for babies right here in Colorado.
And at this altitude, there are a lot of babies who will not reach that 95% saturation because of our altitude and be perfectly normal.
So 2 PSL doctors are now conducting their own study to determine what a healthy number is here at a mile high.
And lawmakers here would then use that study to actually tailor a law in Colorado with the recommended saturation level here at this altitude rather than using the nationwide 95 number. Reporting live in the newsroom, Dale Cedars, 7 News.
All right, thanks, Dale. Also at the Capitol today, the state Senate giving tentative approval to a bill requiring hospitals to tell patients about services they won't provide because of moral or religious objections. The bill is already under fire for singling out hospitals for their religious beliefs.